Thank you very much for the invitation to be here and give a talk about micronutrients. And I will do this from an industrial perspective. We in our team, we have collected data about micronutrient intake status and try to connect what does this mean, what we find on status, on health, risk for non-communicable diseases, and wellness. And if we can identify factors, what does it mean in terms of healthcare costs, life expectancy, and building on this, what kind of solutions we can develop. And this can be education, this can be fortification, supplementation, or others. So let me start with this slide saying nutrition more than ever is important for many reasons, because on one hand side, yes, we grow as a population, maybe up to 9 billion or more. We have global trends like aging population, the urbanization, trend to processed food, and so on. We have a rise in the non-communicable diseases. Think about the figures, more than 370 million people with diabetes, 200 million cases on osteoporosis, and so on. And still, after 100 years of vitamins, we see vitamin deficiencies. So saying healthy nutrition, like this, thank you. Healthy nutrition is one of the most important topics for this century. Okay, what do we expect with nutrition when we take a diet like this here? We think that we get the essential nutrients, so the vitamins, the carotenoids, the omegas, minerals, amino acids, and so on. And what I learned, I will change this to phytochemicals. Okay. However, looking into details, it is different. This is a summary from WHO and WFP, and they are saying more than 60% of deaths are due to nutrition-related diseases. And we know more and more about the impact of the 1,000 days, which are essential for the optimal development of children. And if a children misses the right intake of the nutrients, it cannot be, it cannot compensate anymore during lifetime. And yes, billions of people suffer from inadequate micronutrient intake. So what does this mean? Let's start, and there is a map available from Science and Life based on data from WHO, which is saying there are about 2 billion people which are affected by hidden hunger. Hidden hunger saying enough intake of calories, however not enough intake on micronutrients. When we look in more details, we get, we learn more. Yes, it is about iron, about 2 billion people low in iron, zinc, vitamin A, around 200 million people, still iodine, 750 million people, which do not get the recommended intake. Vitamin D, maybe around 500 million. Folate, we do not know exactly. However, we know that there are about 500,000 children born with neural tube defects every year, so indicating that folate intake is not according recommendations, PUFAs, and so on. So deficiencies and the inadequate intake of micronutrients are found in all countries, and this is just the report from last week from FAO. They are saying all over the world, even in wealthy regions and wealthy countries like here in Europe and the US. Now, we have started to collect data and have analyzed intake surveys which are available from governmental organizations. So we have done, they are available, for example, for Germany, for the US, United Kingdom, the Netherlands, and others. And we said we do not look on details, on figures. We use a kind of traffic light, and we use a red light if the intake is different. If more than 75% of the population is below recommendations, and we use a green light if more or less the full population is according recommendation, and use the figures in between. And from the colors you realize that in all countries there are some of the vitamins where intake is really low. For example, Germany, vitamin D, or this is true for most of the countries. Also folic acid in more or less all countries low. In the US, fat-soluble vitamins intake lower, vitamin E, vitamin A, vitamin D, and so on. You see that for some of the water-soluble vitamins, intake is according recommendation. This is a map from IOF, last year published. It is the analysis of more than 200 studies where the vitamin D status was measured. And there are colors used: red, if the status is really in the deficient range, so below 25 nanomoles per liter, or green, if it is the desired status, and there's still a scientific discussion going on, what is the right cut-off point. So IOM is saying it is about 50 nanomole per liter, while some organizations, Endocrine Society, IOF scientists are saying the benefit is only achieved if you have a status of 75 nanomole or higher. And if we take this and let me say do a rough calculation, it's an estimation, this would mean if we take 75 nanomole as the cut-off point, around 6 billion people are below. So if we extrapolate to the full populations, if we take 50 nanomoles as the cut-off point, it's still 2.5 billion people. And as mentioned before, if we talk of a deficiency, around 7% or 500 million people globally are below this point. Let's take PUFAs. PUFAs, there are not in all countries recommendations established. So this is intake, what we know. There are countries which have very low intake, other countries which have a high intake, especially if they have high fish diets. There are some recommendations from organizations like FDA, ISFAL, and so on, what would be a kind of consensus for intake. So in summary, also for PUFAs, we realize that intake is not according to this consensus recommendations. So, in summary, we can say the inadequate intake of nutrients is a global topic, a global challenge, a global issue. 1 out of 3 people in developing countries are affected by vitamin and mineral deficiencies. This is cited from the World Hunger Organization. And in developed countries, yes, for some of the nutrients, we have a high inadequate intake. So what does this mean? Mentioned already, deficiencies still around, and deficiencies are easily diagnosed. So because we have a deficiency disease, like in the case of vitamin A deficiency, and so on. It is more difficult to assess the impact of an inadequate status. And yeah, we can say Bruce Ames helped us because he said we need a balanced intake of all the nutrients, otherwise this has an impact on long-term health. So with this assessment, we tried to identify what can we use, how can we interpret data like this data from the WHO, the report from 2010, which was saying that around more than 60% of global deaths are already due to non-communicable diseases, so nutrition-related diseases. Also learning that around 30% of NCD deaths are in low and middle income populations and occur already before the age of 60. And WHO continues and states a major part of this could be prevented with the right lifestyle, and nutrition being an important part of this. This is the publication in the Lancet in December saying the causes of deaths have changed only in 20 years, a major change, so the decrease of infection-related diseases and the increase of the nutrition-related diseases. Now, let's look forward. This is an overview on the role of micronutrients in relation to some of the, let me say, non-communicable diseases. And what this slide is saying, what the message out of this slide is, that we should not talk about one of the micronutrients. However, look on the combination, on the synergies, on the interaction of the different micronutrients. And the second question is, do we have enough convincing evidence to state, to make relations of nutrient inadequate status and non-communicable diseases? One finding is here. This is the follow-up analysis of the Physician Health Study 2, which was published last year. And the finding was that those who got this multivitamin mineral complex had a lower risk, a risk reduction in cancer by 8%. And if you argue what is 8%, I'm citing Balz, who was saying an 8% drop in overall cancer rates is not small, because given the high number of new cancer cases diagnosed in the US, this translates into about 130,000 cancers, which can be prevented year by year by this approach. Let's move forward. Vitamin D and the inadequate status of vitamin D. We know on one hand side vitamin D is very much related to bone strength, risk reduction for osteoporosis, and there are emerging benefits in other fields like muscle strength, immunity, cardiovascular disease, cancer, and so on. We have done a study, a small assessment in Germany, saying what is the impact on the medical cost or cost reduction if everybody would have an optimal vitamin D status. So we started, what are the number of osteoporotic patients in Germany? This is around 8 to 10 million. There are around 150,000 hip and other fractures. And if we take the meta-analysis of Heike Bischoff and others, which is saying you can achieve a 20% reduction of fractures by a good vitamin D status. So this would result in a reduction of more than 5,000 hip fractures and more than 18,000 vertical fractures. And this translates into a healthcare cost reduction in the range of 585 to 778 million euros year by year. So arguing with a good vitamin D status, Germany could achieve this. If you look for Europe, there are more data available. So if you expand this thinking and extend to other, let me say, health issues, for Germany, if you add also the impact on osteoporosis, cardiovascular disease, and so on, the savings could be up to 37 billion euros every year, and for Europe in the range of nearly 200 million. On the other side, to achieve an optimal level on vitamin D is a cost-effective measure, because the supplement for one person is in the range of around 20 to 30 euro a year. Let's move forward. PUFAs. We already saw that intake is low in many countries. PUFAs have a beneficial effect all over the life cycle, so from the pregnancy phase to promote, let me say, the fetal brain and eye development later on, to improve visual acuity and other factors later on in adults, has an impact on heart health, and for seniors in an improvement or in a reduced cognitive decline. Whoops, now it's a slide missing, but my message would have been, with a good intake of PUFAs, we would also see a reduction, a benefit in many of these areas. And to quantify this is right now a challenge. Can we quantify effects like this? Let me move forward to diabetes, and here starting with this slide saying this was characterized recently in Nature as the time bomb due to the increase in numbers, and especially as this has an effect that let me say disease, the risk disease, is given to next generation. We expect high numbers for the coming decades. So what do we know about impact of nutrients? And here we have a very nice result from this study from Millman. And this group was studying the genetic, let me say, impact, the polymorphism on the risk for cardiovascular diseases, events in the different genotype groups. There's one genotype, the so-called haptoglobin 2-2, where the haptoglobin has a fourfold matrix, and by having this, the antioxidant capacity is gone. So if you add vitamin E, so 400 units per day, this group, which has a lower life expectancy, comes back to the other groups. So saying, understanding the genotype may help to define nutritional solutions. This is a meta-analysis showing the impact of vitamin D on diabetes too. And you can see this, that an optima, the right status on vitamin D, can have a major impact on risk reduction. Now, I said we would like to quantify what is the benefit of the right nutrient intervention. There are many calculations available. They talk about a cost-benefit ratio, and when you see this, the cost-benefit ratio for nutrient intervention are quite positive. So spending €1, $1 brings a benefit of $40, $70 back. Or also this here is saying from the Copenhagen consensus that the elevation of micronutrient deficiency would result in or can result in a 2 to 3% growth of GDP. We are engaging to further assess this, and we had recently organized a workshop at the university in Groningen to identify what is the status and what are models to assess this benefit, and to generate a consensus in the assessment of the economic impact of inadequate micronutrient intake. And we have right now a kind of position paper available, which will be now developed into a publication. The question is, how can we measure? As I said, the focus of the experts was on DALIs, on other topics, and there are some other opportunities to measure the impact of a healthy diet, of healthy nutrition. One is life expectancy, and this slide is saying, this overview is saying, there's a huge difference on one hand side in life expectancy. This is healthy life expectancy, and when we look on this part of the slide, we can make a ratio of the healthy life versus the unhealthy or the dysfunctional life. And we are right now working, can we identify this as a kind of measure to, let me say, develop solutions where we increase the blue, the healthy part, versus the unhealthy and dysfunctional part. So this will be the challenge now, and I look forward for much more input from science in order to understand the role, the relation of micronutrients, of nutrients and non-communicable diseases. This is already an old phenomenon, what I tell, because it was already Hippocrates who said more than 2,000 years ago, if we could give every individual the right amount of nourishment and exercise, not too little and not too much, we would have found the safest way to health. Thank you very much.
Thank you very much. Perfect timing. Couldn't ask for better. Now it's open for discussion. Any questions?
Manfred, I enjoyed your presentation. I'd just like to make sure that we don't overcalculate the number of people who are low in micronutrients. Remember that the dietary reference intakes take the mean requirement and double it. So by that definition, 95% of the population meets their intake even if they're taking less than the required amount. So by saying that many people don't meet the required amount, by definition, they won't just because of the way we define the requirement. And the reason we double it is to make sure that we capture the outliers who have metabolic variation that make them require more. And so my guess is that those numbers for how much of the world is running low are probably been doubled, and we might want to have them.
Correct. I think this is a very important comment. We are thinking, can we change, let me say, the assessment? Anyway, we build on figures which are, let me say, available from organizations like WHO, like WFP, like FAO, in order to be on at least accepted grounds. Yes, nevertheless, you are addressing a key issue and a key topic. Mm-hmm.
Question? There's a question out there.
Would you think that the low micronutrient is also due to the social demographic distribution among the population?
Correct, yes. If you define social demographic relation, the difference between low-income populations and high-income populations, we can make relations. We have, for example, even for Germany, which is generally recognized as a rich country, indications that in those groups, for example, which have Hartz IV, so low income, that there is some stunting in these groups, so low quality food, low micronutrients, and so on, with impact then on mothers and children. Definitely, yes. There are good data available, for example, from the UK, saying if you are poor, your life expectancy is lower by a number of years. Data are available for other countries in a similar ratio. Right.
Other questions?
Some companies are investing in personalized nutrition. As far as I know, DSM is not particularly into this field. Do you think, also according to the last quotation you gave confidence, that this is the way to solve the problem of adequacy of nutrients, micronutrients, active compounds, and so on, or what is your position about?
My opinion is the following, and I think the development is going into this direction. If we know as a person what is my individual status, a person will act accordingly and will take care for a healthy food. So we see a huge, let me say, development in tools where you can get an immediate feedback. What is your status on the different nutrients and so on? And there are tools in development where you get then via phone a feedback, what you should take, what you should eat, and so on. So if you may express, if you may characterize this as individualized nutrition, when you know what is your status, what are your requirements, and then you act according and take a diet accordingly, yes, I do see this as a future development. And I see so much progress in this field that these tools will be available already in the coming years.
Thank you. Thanks.
Thank you.